Dear colleagues, let me introduce our research influence of cryopreserved piglet skin fragments or aqueous colloidal solution of C60 fullerene on destruction and inflammation severity after skin cryodestruction. Cryoablation is widely used in oncology for removal of benign cutaneous neoplasms and in the combined treatment of malignant tumors. Cryosurgical method has important advantages over other surgical methods, such as ablasticity, cryoimmunization, and analgesic effect of cooling. Skin wounds after cryodestruction have longer healing period in comparison with injuries after electrocoagulation or scalpel excision. Deep cryolesion accompanied by development of manifestation at local and systemic levels. Lipid peroxidation, antioxidant activity, and acute inflammation markers in blood serum reflect depth and severity of the pathological process. Acceleration of wound healing after cryodestruction with achievement of organotypic regeneration are actual problems which can be solved so the combined therapy with immune biological products or carbon nanoparticles. Extract of piglet skin cryopreserved fragments are known to accelerate the cold wound healing. C60 fullerene is a short allotropic form of carbon, after diamond and graphite. Nowadays, fullerene and related carbon-based derivatives have a wide range of biological applications. Preliminary biological studies of water-soluble pristine C60 fullerenes have shown that at low concentration they are not allergenic and immunogenic, and they are able to regulate free radical processes in cells and tissues. In particular, neutralize excess free radicals. But information about toxic effect of fullerene C60 nowadays are contradictory. The research aim was to determine the extract of piglet skin cryopreserved fragments and the aqueous colloidal solution of fullerene C60 effects on serum markers level of inflammatory and destructive processes in rats with cryodestruction. The research was performed in 6-month Sphinx male rats. Animals were divided into 4 groups. All animals except the intact ones were subjected for modeling cryodestruction on lateral surface of the thigh. The extract of cryopreserved piglet skin fragments was administered intraperitoneally once a day in dose of peptides 0.5 mg per kilogram body weight during the whole experiment in experimental group 1. A saline solution was injected in the control group. Aqueous colloidal solution of fullerene C60 was used for 5 days in dose 0.1 mg per kilogram body weight in the experimental group 2. Highly stable reproductive pristine C60 fullerene aqueous colloid solution was prepared and characterized according to the protocol. The content of deconjugated barbituric reactive substances, ceruloplasmin, C-reactive protein, and superoxide dismutase and catalase activity were assessed by 7th, 14th, and 21st day of the experiment. Cryodestruction in the control group was accompanied by an increase of DN conjugates content by 7th day in 1.7 times, by 14th day in 1.5 times, and by 21st day in 1.4 times. There was a normalization of the DN conjugates content by 21st day in the group with extract introduction. In the group with FULLERENE treatment, we observed normalization of DN conjugates value by 14th day of experiment. The CRYODESTRUCTIon in the control group was accompanied by an increase of thiabarbituric acid reactive substances contents in 1.7 time by 7th day. The values of thiabarbituric acid reactive substances were normalized by 21st day of the experiment in the group with extract treatment. In the group with FULLERENE treatment, we observed normalization thiabarbituric acid values by 14th day. The CRYODESTRUCTIon in the control group was accompanied by a decrease in the activity of superoxide dismutase by 7 day in 2.3 times, on day 14 in 2 times, and on day 21 in 1.7 times. In the group with extract treatment, activity of superoxide dismutase was increased by 14th day and by 21st day on 1.5 times in comparison with control group. The activity of superoxide dismutase was normalized by 21st day experiment. In the group with FULLERENE treatment, we observed increasing of superoxide dismutase activity by 14th day in 1.6 time and by 21st day in 1.7 time in comparison with control group. An augmentation of superoxide dismutase activity was noted by 21st day of the experiment. The CRYODESTRUCTIon modeling in the control group was accompanied by a decrease in the activity of catalase by 7th day in 2.1 times, by 14th day in 1.9 times, and on 21st day in 1.8 times respectively. In the group with extract treatment, the activity of catalase was increased by 14th day in 1.4 and by 21st day in 1.7 times in comparison with the control group. The activity of catalase was normalized by 21st day of the experiment. In the group with FULLERENE treatment, we observed increasing by 14th day in 1.5 and by 21st day in 1.7 times in comparison with control group. An augmentation of catalase activity to the normal values were noted by 21st day of the experiment. CRYODESTRUCTIon in the control group was accompanied by an increase of C-reactive protein contents by 7th day in 3 times, by 14th day in 2.5 times, and by 21st day in 2.1 times. There was a normalization of the C-reactive protein content by 21st day in the group with extract and FULLERENE introduction. CRYODESTRUCTIon in the control group was accompanied by an increase of ceruloplasmin content by 7th day in 3 times, by 14th day in 2.6 times and by the 21st day in 2 times. In the group with extract or FULLERENE treatment, we observed normalization of seroplasmin values by 21st day of experiment. Normalization of the content of DNA conjugates and barbituric acid reactive substances after administration of aqueous colloidal solution of FULLERENE was established starting day 14 of observation and starting day 21 after application of extracts. Increasing the activity of superoxide dismutase catalase on day 14 and its normalization on day 21 of the experiment were determined after treatment with extract and fullerenes. We observed the contents of C-reactive protein and ceruloplasmin decreased for observation periods with their normalization on day 21. The use of an extract of cryopreserved fragments of piglet skin and an aqueous colloidal solution of FULLERENE C60 after skin cryodestruction reduced levels of markers of destructive and inflammatory processes in red serum. Thank you for attention.